Hello, my name is Pat Sullivan, Fire Chief, Harrison County Fire Rescue. I want to take a few moments and speak to you concerning the response to the COVID-19 pandemic threats that we're facing and the issues that we all are aware of right now. The Harrison County Fire Rescue is very involved in EMS response, emergency medical services response. We have paramedics and EMTs on all of our trucks. We respond to heart attacks, we respond to seizures, we respond to accidents, as well as the fires that we respond to. And this time that we're going through right now is a very interesting time. There's a lot of unknowns, there's a lot of confusion, there's a lot of misinformation that's been put out there. There's a lot of good information that's out. Our purpose, and my purpose today, is to speak to you about our response in Harrison County. We know with the information that we are gathering and the information that's being put out by the CDC that we do have a potential of having exposures, and we are taking all the steps that we can take. We're gathering all the information that we can get. We're getting all the equipment, the personal protection equipment that the firefighters need to respond to any type of call. We know with the recent information that we've been getting from the emergency management, from the CDC, from the state health department, that there are potential exposure problems. All this information we are taking into consideration and changing the policies that we need to change to make a more protective response to the threat of the COVID-19 virus. Our primary concern is the well-being, of course, of our employees, their family, and the public that we serve, and to make sure that we're doing the things that will keep our people safe, our employees safe, our responders safe, and the general public when we're responding to them. A couple of things that we're doing right now is re-educating everybody as to what the signs and symptoms of this particular virus is, what the protection we should be wearing when we cross the threshold of somebody that could possibly be infected. We are looking at all of the things, the recommendations that the CDC has put out and the state health department has put out. We're putting those into place as far as our protective gear. We're also doing doubling our efforts on cleaning our stations, cleaning our equipment, cleaning our trucks, sanitizing all of our stations, all the equipment that we use. On every call, we come back and make a thorough cleaning of this equipment. We're looking at every call and determining which calls have the potential for being a coronavirus type of call. Specifically respiratory problems, fevers, flu-like symptoms. Those kind of calls are indicative of the coronavirus symptoms. So, though we take precautions on all calls, we wear our protective gear on all calls. These particular calls, we're going to change our policy to address that and to make sure that our employees are not needlessly exposed to the virus. One of the things that we're doing, in addition to what we've already done and that we do every day, is coordinate our response with American Medical Response. We may have a reduced response to some calls where there's a potential of an exposure, and in those calls we want to reduce the number of people that are actually exposed, actually in the room with the patient. And so some of the things we're doing will help us to reduce the exposure to our employees, to our responders, and also to help protect the general public. We are out there continuing to respond. We are out there protecting the public. We are out there with the understanding that our employees are putting their health on the line, but doing so willingly and being protected and being followed and advised is what the best procedures are. We will continue to do that, and we will all get through this. The thing that we highly recommend is that you get good information. There's a lot of information on the internet, there's a lot of information on Facebook, there's a lot of misinformation also. Go into the CDC, the Centers for Disease Control's website has the latest and the greatest information. the Mississippi State Department of Health information. Our emergency management agencies are on top of this, giving out information to the public and to us, advising us what the latest information is. The one thing we don't need to do is panic. The one thing we don't need to do is get in a situation where we just believe everything that we're told without verifying the facts. If something sounds outlandish to you, then try to determine where that information came from, or if that information is actually true or not. There's no reason for panic. There's no reason for people to not take care of one another. There's no reason to expect that we will not respond and take care of you if you call for help. We're here for Harrison County. We're here for the citizens, for our guests, for those passing through. Harrison County Fire Rescue will still be making responses, still responding to fires and medical calls. There's a strong partnership in the first responder community in Harrison County. All agencies, all fire agencies, police, EMS, all agencies working together back one another up. We're all in this together, and we're doing coordinated efforts of information, sharing information with one another to make sure that we have the latest information on protecting our employees, to making sure that their families are going to be safe, and protecting the public in general. The thing to do is not to panic. The thing to do is take care of one another, to follow the directions that you receive follow directions from the Emergency Management Agency when they're giving out information. Follow information that the health department is giving out. We highly recommend that we follow the reduction in groups, meeting groups, more than 250 people. We highly recommend that if you have a fever or if you have flu-like symptoms, that you stay home, that you don't go to work, that you don't have the potential for spreading something, even if it's the flu. Make sure that you cover your cough. Make sure that you don't spread those germs outward. Washing often, and that's one of the things that we're stressing upon our people, is to wash often. If it's every 15 minutes, that's okay. One of the things that we are striving for is to make sure that every time they come in and go out of the station, that they come back and they clean the surfaces of everything that they touch and disinfect and make sure that they have not brought anything back into the station with them. We'll still respond to heart attacks. We're still going to respond to strokes and the calls for help from traffic accidents. We still respond to fires. We are not going to stop responding, but we're going to use the intelligent response. We're going to use the most up-to-date information to dictate how we respond and how we treat people. We will get through this. There's no reason to panic. This is something that the coast knows about resiliency. The coast knows that you have to stick together, you have to work together, that you have to take care of one another. We have faced many crises on the coast, from storms and oil spills and those things. But we are a resilient people, and we're a resilient community, and we will get through this also.